Tonight we're hearing from both sides in a debate over a new bill being considered at the State House that would allow teenage girls to consent to pregnancy-related medical care.
More than 200 doctors, nurses, and midwives at Women and Infants signed a petition in support of the bill. But opponents worry it's a slippery slope. Eyewitness News reporter Kim Kalunian joins us now with what she's learned. Kim?
According to the Guttmacher Institute, Rhode Island is one of 13 states that has no law specifically addressing minors and their right to consent to pregnancy-related care. And now some local OBGYNs want to change that. Dr. Emily White says current Rhode Island law sometimes prevents her from managing her patient's pain.
We have the resources, we have the know-how, and yet there's nothing we can do to help her pain.
It's the legal mandate. Under current state law, if a pregnant woman is under the age of 16, she needs a parent or guardian to consent to such care.
Recently, we had a 15-year-old girl present to the hospital in labor, and she was alone and terrified and in pain, but her parents were unavailable, and so she was unable to receive any sort of anesthesia for her labor. And this is not a unique case. It happens quite often.
A new bill would change that and allow all women, including minors, to consent to pregnancy-related care, excluding abortion. But Rhode Island Right to Life, a pro-life organization, worries the language in the bill is too broad and minors might consent to unnecessary, dangerous, or overly expensive care. They propose instead that minors can only consent in the absence of a parent or guardian to services ranging from pain control to life-saving measures and routine vaccines. Doctors would notify DCYF if parents or guardians showed signs of abuse or neglect.
This is not a controversial issue. Most states do allow teens to consent for their prenatal care, and this ranges from Massachusetts to Alabama. Rhode Island is an exception.
And this bill was set to be heard last night by a House committee, but it was pulled at the last minute. A State House spokesman tells us the bill's sponsor and the committee are working on the bill, and it could be heard again before the end of the session. In the control room, I'm Kim Kalunian, Eyewitness News.